Welcome to Herbally Yours, an adventure into the world of natural medicine. Here is your host, Dr. Ellen Kamai, the natural nurse who will help you take the leap to ultimate wellness.
Greetings, and thank you so much for joining me, Ellen Kamai, the natural nurse, for another edition of Herbally Yours, right here on the voice of Nassau Community College, 90.3 WHPC. Herbally Yours brings you the latest information about the many facets in the world of natural living. Today, we are so happy to have as our guest Dr. Joseph Pergolizzi, medical doctor from Healthy Directions. He is an internationally renowned perioperative and pain specialist, well-versed in multiple issues confronting people in acute and chronic pain situations. He runs a pain center in Naples, Florida, and is chairman of the Abstract and Poster Selection Committee for Pain Week, and is a member of the Change Pain Board. Additionally, has been awarded the American Medical Association Physician Recognition Award with commendation. So thank you so much for joining us today, Dr. Pergolizzi.
Well, thank you, and good morning to everyone.
So I want to go back in time and share with us, why did you decide to become a doctor in the first place?
Oh, that's a great question. I really wanted to be able to help people. And how I felt one way to be able to do that was to be able to address some of the biggest problems they have that can affect their activities of daily living and their functionality and their person as a whole. And so that's what led me into medicine. And that's what ultimately led me to become a pain physician, because pain is the number one reason why people seek medical care.
That is true. And I've written many books. One is called Arthritis, the Alternative Medicine Definitive Guide. And we really go into pain in that book. I'm talking a lot about what you point out. And what do you mean by you are an inventor and research scientist as well as a doctor?
Well, that's, again, a great question. The difference is that I like to look at things very pragmatically. And when I see that we don't have a solution, I try to come up with a means or ways to address that will ultimately benefit the patient and benefit healthcare delivery as a whole. So I'll go back to my lab, or I'll work with students or other colleagues to figure out ways to better bring about solutions for patients. And a lot of those solutions, I think, align with some of the reading that I've read of yours, which includes natural opportunities for patients.
Well, thank you for that. And also, as a pain specialist, I'm wondering what your view is in terms of, this opiate crisis, which has been so much in the news, because I feel like in some ways, when I have dealt with patients in really severe pain, that the fact that now they can sort of no longer get opiates at all, may also be an overreaction the other direction.
Well, I think it's basically a balancing position that we have to take on. And part of it comes with the fact that we must understand that there are different types of pain, and that pain comes in different levels of severity. So almost the term that I like the best is 50 shades of pain, let's call it. If you have pain that's very severe, then this is something that you need to seek medical attention for. And if you have acute pain, what we hope with acute pain is that once the causative agent, that problem that's caused you pain, it is resolved and heals, you shouldn't have any more pain. The problem is that there's a percentage of patients who go on to have chronic pain. And I think that's where some of these problems really have started, is how we best deal with patients who have chronic pain and what type of medications we can use for them. And I think what I advocate is the right one, which is what we call a multimodal pain therapy. That's pharmacological and non-pharmacological remedies together. And I think you're right that certain patients will benefit and have relief by the use of opioids. An example are cancer pain patients. Unfortunately, 80% of the people who experience cancer also experience pain. And what about the patient who has had pain in the past, chronic pain, and then unfortunately gets a diagnosis of cancer, and that brings yet additional pain? These can be very problematic issues for the everyday non-pain specialist to take care of. And that's where we have to start thinking about what the best alternatives are, both pharmacologically, meaning drugs, and non-pharmacological. And that can include natural products, physical therapy, massage therapy, meditation, and things to that effect.
Right. So you're bringing together a host of factors that can really be helpful in pain. And that's the name of a book, Dr. Pergolizzi, 50 Shades of Pain. I bet you can write that book. It's a great name. Oh, really?
Well, thank you. And from an esteemed author like yourself, I may take that advice.
Yeah, well, you came up with it. So, just jot that down because you have all the content here. I mean, you've actually also been the author of published studies, and you've been really delving into this for, your entire career. So one thing that's interesting is that you did mention, besides medications, which I think are important, especially for short-term use, and you don't want to get into the addiction capacity of pain relief meds. So you're talking about so many other things that people may not even be aware of, such as the link to pain of things like stress and dehydration and lack of sleep.
Yes, you're absolutely right. And I can tell you that for most people, these are usually surprising sources of lesser known reasons for muscle pain. And they do include stress, dehydration, not getting proper nutrition, and the lack of sleep. And this is very important for us to think about. When our body is in pain, we have to try to bring it back to where we were before. And it's important that we focus on those 4 areas that we can really control on our own. Now, it's not easy. If you're in a lot of pain, it's usually hard to sleep. So it's that combination of understanding what is readily available as a patient or a consumer that you can go to, and addressing stress, dehydration, proper nutrition, and sleep are ways to do that.
Well, those are really things that people could start to think about. Now, tell us about your vision and what is Healthy Directions?
Sure. Well, my vision is to be able to provide patients with options. And those options should allow the patient to make better decisions when it comes to addressing painful conditions. And I think that as a country, we suffer from what's known as health literacy. And that does not mean that you're not smart or learned. I'll give you an example. I'm not a dermatologist. So if I have something that a dermatologist finds on examination and says, hey, you need to worry about this, Dr. Joe. Well, I can go to the computer or to the literature or to the library in the medical school, and I could find out what is this? What is Merkel cell carcinoma? And even then, I'm not going to really know 100% about it because it's not my specialty. And so now take this and magnify it 100%, because it's not like when we're in high school, we're learning about complex medical conditions. So it becomes very difficult, particularly when you're in pain and you're not thinking right, to find a solution. So what I try to do is provide optionality for patients and in a stepwise approach. And Healthy Directions has helped me do that in a sense because they provide a myriad of different types of natural products things like chondroitin that is good for your joints, turmeric, which may act as something to decrease inflammation. I have a product that they distribute called Instaflex. And this is a product that uses a very low dose of menthol with an oxygenated oil. And in the clinical studies, it showed that this combination was effective. And they're able to help bring this opportunity to the market so that patients have more choices and they have more optionality.
Okay, well, let me reintroduce you. You are listening to Herbally Yours on the voice of Nassau Community College, 90.3 WHPC. I'm Ellen Kamai, the natural nurse. And today, my guest is Dr. Joseph Pergolizzi, MD, and he's an internationally renowned pain specialist. You can find him at drpergolizzi.com. And don't jot that number down while you're driving and listening to us in your car, because actually this is on real radio in people's cars, believe it or not, as well as being, podcasts afterwards. But we will have a live link to his website, and you can get in touch with him for more information. So something that's very interesting that you brought up, Dr. Joe, is that even a viral infection, and people are all very super aware of viruses during this time of COVID-19, can also increase pain. Why is that?
You're absolutely correct, and great point. And we know that the pandemic has been very difficult for many people. And we understand that during this time where we have increased stress and worriness, that itself is going to add to pain, as we mentioned before. But when a body is infected with the virus, the immune system works to fight the infection. And this infection could lead you to feel muscle inflammation and weakness. We call that myositis. And joint pain and muscle pain, which we call myalgia. So acute viral myositis is rare, but it does occur during the recovery phase of an illness, most commonly influenza. And it's characterized by muscle pain and weakness, and isolated laboratory findings can be related to this as well. But when you look about how viruses can affect us, I'll give you a couple examples. Infectious or post-infectious reactive myositis. Remember, that's inflammation of the muscle.
Yeah, that's a big word. I was going to say, let's explain that to our listeners.
Big one, yeah. That's when you have muscle inflammation or muscle weakness. And when you include joints, then that's called myalgia, right? When we have muscle pain and joints. So after you have an infection and you have this muscle inflammation, which can be related to pain, that can occur during some viral infections. Even after the infection's gone, the immune system may cause this inflammation in some part of your body up to a few months. And symptoms are similar to this sort of widespread muscle inflammation and pain and weakness. Another example that many can relate to is the reactivation of chickenpox. Chickenpox is the herpes varicella zoster virus. And the zoster virus, when we're older, it gets reactivated in our body. And particularly when we have immune reactions or a decrease in our immune system. And this can cause a complex called shingles. You may have heard of that, or the listeners may have. And shingles is a very painful, acute reactivation of chickenpox when you're older or immune suppressed. Now, thankfully, that can be treated with medication, but some people, a percentage of them, go on to have chronic pain related to that inflammation of reactivation of chickenpox, and that's called post-herpetic neuralgia. So you could see that viruses can have an effect both on the muscles, the joints, and the nerves. In this case, it's an infection of the nerve, and it could result in chronic pain.
So that's something that, people may not think of, but is a sequelae for various viral infections.
Yes.
Now, I know that there's something interesting that you talk about that some people may have never heard of. So let's delve into some of the effects of topical pain help.
Absolutely. When we look at our options, topical pain relief presents an option, particularly when we have pain that's localized. So joints close to the skin surface, such as the knees and elbows, can absorb topical pain relievers relatively quickly and show positive effects faster than most oral pain relievers. Also, you can take another dose much more quickly than you can a second dose of most oral medications. So when it hurts, especially when the pain interferes with your activities of daily living, first you need to perform an assessment of your pain based on the severity of the pain and where the pain's located. And if the pain is local, like in a joint or in your muscle, then you can start with a topical medication. And this is the reason why when we ask pain specialists, myself in a survey at the major pain conference, most doctors said start with a topical medication.
Well, first of all, the degree of perhaps addiction and also other negative effects and interaction with other medications would certainly be much lower.
That's correct. When you look at topical medications, pain medications, they're supposed to stay right there in the skin area. And they're not really supposed to be absorbed into the body. We do have some medications that we put on topically so they can be absorbed in the body. And that a lot of times we use when people can't swallow or people have problems digesting the medication. But that's called transdermal, meaning through the skin. Topical medications really stay at that local place in the skin.
Well, so we hope, but that's the differentiation, that when we talk about things that we might use topically, they may not stay right on the surface of the skin, but they don't seem to go into the circulatory system and become more systemic, while transdermal do. And examples of transdermals that our listeners might recognize is like a nicotine patch.
That's exactly right. A nicotine patch, or sometimes people will go on a cruise ship and they'll get a scopolamine patch, the one you put behind your ear. And that's meant, like you said, to go into the whole body, the systemic circulation.
Well, let's talk about something that I know you have worked with, and that is called oxygenated oil. I'm sure many people have never even heard of that.
That's a very interesting topic, and it goes back to one of my visits to Europe when I met with one of the German Olympic weightlifting coaches. And he had asked me, Dr. Joe, what can I do for my weightlifters who get sore and have pain after they do these very strenuous workouts? And we sat down and thought about it. The Olympic Committee does not allow you to use a lot of synthetic agents for pain relief. And so these athletes are constantly being tested. And we looked at a product out of France that was a topical oil that seemed to provide an unexpected pain relief. And when we rubbed this on these athletes, they were able to get good pain relief, and they also were able to have quicker restoration of their ability to do more exercise. So we thought that this might be something that might be helpful with a traditional pain medicine. So we combined it with menthol, and instead of using a high dose of menthol, we used a very low dose of menthol in combination with an oxygenated oil, and we got an unexpected event whereby we were able to get as much pain relief, and it even lasting longer when we put this combination together than just a higher dose or a dose of menthol by itself.
So how do you get the oxygen into the either it's an oil or a cream or whatever using as the topical agent?
Excellent question. Well, it goes way back to almost the Egyptian times, where they would take these special types of oil. This one's a corn-based like oil, and they would poke holes in the big vats that the oil was in and put straws in those holes, and that would bring oxygen into the oil. But it would take years to be able to accomplish that. So a group out of France in the Pasteur lab went and tried to accelerate this process. So what they do is now they take the oil and they use a certain light source and they bubble oxygen into it. And if you've ever taken, let's say, olive oil and shaken it up real quick, you'll see that all of a sudden there's little oxygen particles in there. So they were able to do that in a very consistent and reproducible manner.
So when you're talking about that, like shaking the olive oil, I think many people may have seen that. You get bubbles in there, but I'm not so sure. Is that actually oxygen or is that just air, which includes some oxygen?
Absolutely great question. So obviously, when we go and do things in a controlled setting, this is where we're able to control which gases we bring in to that closed big container. And in this case, we're only bringing oxygen into that container. Because you're right, when you think about air, we have other constituents of air, which include nitrogen and carbon dioxide and other things that are in the air that we breathe. But here, it's a very controlled setting. So you can picture a very big, large metal vat, almost like if you looked at a Budweiser beer commercial and they show the big sized metal vat. And then you can imagine oxygen from a cylinder being pumped in there at a certain rate for a certain amount of time, and then testing it. And we keep testing it to make sure that that certain amount of oxygen is in that oil.
Well, that's very interesting because it seems like something that would be very non-toxic for someone to use versus the fact, I mean, we certainly have to say, and you're a specialist, that a lot of pain meds are not only addictive, but they have a very complex variety of adverse effects, even over-the-counter medications such as NSAIDs and medications such as those.
That's a great point to bring out. And we can look at that in two ways. We can look at it from the pure pharmacology standpoint, meaning that when we take a drug, we want it to work a certain way, but we also know that it can cause other problems. So the terminology is called an on-target effect. So I give you a pain medication, it's supposed to reduce your pain. But because they go throughout the whole body, as you so appropriately pointed out before, you can have what's known as off-target effects. And the off-target effects can be those type of side effects that limit your ability to use the drug. That's why we have to keep in mind that every time we take some type of intervention, there potentially can be a side effect. And what consumers and patients need to do is ask those questions, whether it's looking at the medication on the shelf in a pharmacy, go up to the pharmacist, ask them, what is the other side effect? Or if you're with your healthcare provider as well.
So that's such a great approach that you have because you are really well known in mainstream. You lecture at medical schools all over the country, and you've even reviewed articles that are in JAMA, the Journal of the American Medical Association, and yet the approach that you're focusing on are using some very non-toxic things such as hyperoxygenated oil mixed with menthol. I think that sounds like an excellent thing for people to try because very little adverse effects to that, I would imagine.
Yes, if you look at the adverse effects from our clinical studies, We saw what we call no serious, expected, or unexpected adverse events. But everybody's a special individual. And remember, pain is very specialized. And your pain may be different from my pain, even though it could be caused by the same thing. And, we have to keep that in mind. So you want to be looking at the potential effects of any drug, any mixture. What I like about our mixture is that we use what's known as a minimal effective dose. And people will say, minimal, that's not good. Give me the 20% concentration. Bigger is better, more is best. But really what we want to be able to accomplish is to give enough to get the same type of relief that you would have gotten if you used more. And it sort of makes real sense that if you use more, there's the potential of having more exposure and more negative effects. So if you're able to achieve that same result at a lower dose, well, you might be able to use more of this, and you might be able to see less side effects.
Well, thank you for all that great information, Dr. Pergolizzi. What is the best way for people to find you?
They can visit my website at drpergolizzi.com, and that is DRPERGOLIZZI. And if I may, I want to say hello to everyone in Long Island. I grew up in West Islip, and so I'm a big fan. And I want to thank all of you for giving me this opportunity to talk about the most common reason why people seek medical care, and that is pain.
Well, thank you so much. And we will have a live link to your website for those who are listening and in the car. Don't try to write that down, but you definitely can find out more about Dr. Joseph Pergolizzi and his expertise in the area of pain relief, which is such a blessing. So thank you so much for being our guest today, Dr. Pergolizzi.
Thank you. And I'd be more than welcome to come on any other time. Just let me know.
Okay, and thank you, listeners, for tuning in to Herbally Yours, produced in the studios of 90.3 WHPC, Nassau Community College, Garden City, New York. For further information, email us at whpc@ncc.edu. This is your host, Ellen Kamai at naturalnurse.com, inviting you to join us again next week for another edition of Herbally Yours. Until then, stay healthy.